Hi there, this is Bev for a Teal Journey. So, as many of you know, I was diagnosed with ovarian cancer not too long ago. Just to give you background, when I was diagnosed was at surgery. So, before that, we weren't sure. So, I went to the hospital on November 30th with a lot of pain in my lower abdomen. I thought it could be appendicitis because it was centered on my right hand side, and that's the first thing you think of. And so I went out to the ER after a couple hours, and they obviously were worried about how much pain I was in because I was kind of breathing heavy, and the lady asked me, "Do you usually breathe like that?" And I'm like, "No, not at all." And so they did blood work. The blood work came back really weird, and my white count was really, really high. So the next thing they did was sent me to CT. After CT, the doctor came back and said that there was some sort of mass on my ovary. So he wanted to send me to sonogram. So I went to sonogram, they confirmed the mass, and they decided to send me home after checking with their on-call gynecologist. The next morning, I was told to contact my regular GYN. So I contacted her the next morning, and she had already gotten the information from the hospital, and the first thing she did was tell me to come in for some more blood work. But they went ahead and sent the information to another hospital that had a oncological gynecologist, so if it was cancer, that she could take care of it. The hospital in my town doesn't have one on staff, so it was about an hour drive away, and I was not happy about having to do that, but it is what it is. And so I went to this blood work appointment, and the only piece of blood work they did was something called a CA-125, which is a cancer antigen test. This came back around 3,000, which is really, really high, and you want it to be around less than 35 for a case of not cancer. So I waited to get an appointment, managed to get in within a week or so with this oncologic gynecology surgeon there, and she was like, "Well, it could still be cancer. We can't tell until we do surgery, but it doesn't look like cancer because there's no other indicators other than the CA-125 being high." So I was glad because I thought, well, maybe it's not cancer. She doesn't really think it is, and she should know. And so they went ahead and scheduled me for surgery on December 31st, and I was glad to get it done as quickly as possible. So the week of surgery, I had to do pre-surgery blood work. So I went and I did this blood work, and the results came back, and my CA-125 had lowered to about, I think it was like 178, which is still indicative of cancer, but like she told me, the CA-125 can be elevated for a lot of different reasons. But she also did another couple tumor markers, one of which was the CA-19-9, and it came back high as well. Chances of both of those being high is very slim, I found out since then. So whenever I went to surgery was slated for an hour, maybe two. The surgery ended up being 4 hours. They had gone in, they took out the ovary, the fallopian tube, and the tumor on the right side. Then those were sent to pathology during surgery. Pathology during surgery decided it was cancerous. So she went in and she removed the other ovary and fallopian tube, the uterus, the cervix, and the omentum. She also removed my 2 pelvic lymph nodes. So the question was, had it spread? So I waited after the surgery, which ended up being 4 hours. It was laparoscopically, so I didn't have a laparotomy. So I'd gone home that night. There were 5 incisions. It took quite a bit of work. And so that was how the surgery went. Pathology report came back, and I read it, of course, but I held off making any, hopeful thoughts until I saw the doctor. I was pretty sure it hadn't spread from the pathology report, so I was hoping that was the case, that she agreed with me. So I went to the last appointment just this week on Tuesday. She said that basically it was a clear cell carcinoma, which is one of the rarest and most aggressive forms of ovarian cancer. of course I would have the rare one. She said, though, it had not spread. Everything else had came back free of malignancy. So that was a good sign. It was staged at 1C1. So catching it in stage 1 has a really good outlook. I found out during some research that 85% of people with this in stage 1 usually survive. 85% is better than the alternatives. So then the next step was to decide what to do afterward. She explained that there's a subset of people that they observe and they don't do anything. She said in my case she would not do that and she would rather do chemo. So we discussed chemo and I of course decided to do the chemo. So the next step in my journey is going to be getting my port placed, then starting 6 rounds of chemo. That hasn't been scheduled yet, so I'm hoping to get that soon. And it's just going to be stressful, and I do realize that. My girlfriend doesn't like me joking about it, but it's my way of dealing, because if I don't joke about it, it's too serious. And I do know it's serious. It's not like I don't, but it was like I named the mass Bob, and I was evicting Bob on my surgery date. And there was something kind of fun about naming him, and it humanized the whole situation. It was less clinical, and this is one of those situations where I have to go forward. I can't stick to the fact that I wish I didn't have cancer. I do. I do have to go to chemo, and there's nothing I can do about that. The reality of the situation is the reality, and you can't fight reality. In my day-to-day life, I teach DBT skills to people, and that's one of the basic things, is you have to stay in the present moment. You can't live in the past, you can't live in the future. And the present moment me has to be satisfied with my life and learning to cope with the fact that I do have cancer, and this is going to be something that sticks with me for the rest of my life. Even after chemo, I will have every 3 months an appointment for an exam and blood work, because it has to be monitored, because recurrence is very common in ovarian cancer, especially clear cell carcinoma. I started blogging a little whenever all this started, and that was fun, but I decided to do a video blog just because I think people don't realize how quickly this kind of cancer can strike. I had a pelvic exam with my gynecologist in February, at the end of February actually. It had been less than 10 months since my exam, and this had grown to 5 centimeters in that amount of time. So I can only imagine how much it would have grown before I had another exam. It was lucky that we still don't know exactly what happened that sent me to the ER, but it was a good thing it did, because it enabled them to catch it before it had spread. The doctor is pretty confident that she got everything. So the question now is that chemo will kill any stray cells, and that's why I'm going to go through it, because I would rather be safe than sorry. I mean, this is a serious thing, and I can't take it too lightly. I feel very strongly that following the medical guidelines is the way to do it. Yes, I'm a witch, and I do like to use holistic medicines for certain things. It's certainly one thing to use honey and lavender for a cough. It's a completely different thing to try to treat yourself for cancer, and I won't do that. I'm going to go for the evidence-based, tried and true methods that work for this, and it's the way I live my life, a mix of spiritual and the scientific world, and I think that's possible to do. But one of the big things that I think I have to do is kind of keep in mind that life is worth living, and this whole incident has given me a new outlook on that. Because when you're facing possible death, and let's be honest, that's what happens when you get a cancer diagnosis, is facing possible death, and this is going to be hanging over my head for the rest of my life. It doesn't just go away. Even after I'm done doing every 3-month appointments, I will see the same doctor every year, because just because you hit 5 years, it doesn't mean it can't come back. All it means is it's less likely to come back. So, this is important, to do everything I possibly can to make sure it doesn't come back. And, my mom had uterine cancer and a hysterectomy and everything, and she had hit her 5 years, and then she never went back to the doctor. There were reasons, and money was one of them. However, she ended up dying from stomach cancer after it recurred. So I'm not going to let that happen. If it does come back, then I'll deal with that at that point. But I'm not giving up. I'm going to fight everything that comes my way. This is my life. I'm going to keep it. I'm going to do the things I love, and I'm going to do them now with a whole new appreciation for them. And I think that that's an important thing to do when you're facing something as serious as that. Cancer is horrible, it's terrible, it's, all of these things. But I can't let it stop me from living, and I won't. That's the main thing, is I can't let it stop my life. And, it's one of those things I won't do. So that's the first episode of A Teal Journey. And I will try to do another one after I find out what chemo is going to entail, and I'll talk about that and getting ready for the port and getting ready for chemo to start. That should be pretty soon, so I'll see you guys when I get there. Have a good day.